Good morning, members of academia. You're welcome to this platform, and thank you so much for supporting it. This is IRH, Integrated Reproductive Health, and multiple choice. We want to discuss in one way or another. It may actually help you. This is Mr. Malambo, the admin for academia page. The first question says the outermost membrane that helps to form the placenta is, okay, basically looking at the options that are there, we discovered to say the answer is the chorion. Now, what is the chorion? So basically the chorion is a membrane that surrounds a developing fetus in the conjunction with the amnion, right? So the chorion plays a key role in the exchange of blood and gases between the mother and also the fetus, and develops into the fetal aspect of the placenta. So basically the chorion also functions to eliminate to eliminate the fetal wastes. So that is what the chorion do. So the answer is not amnion, but basically the answer is chorion, right? Chorion, the outermost membrane that helps to form the placenta, is the chorion. Okay, let's move on to the next particular question. The next question has this to say, right? It has this to say: the progesterone is secreted in relatively large quantities by which one of the following structures? So we want to know what basically produces this hormone as a chemical. Okay, progesterone is secreted in relatively large quantities by which one of the following structures? Could it be adrenal cortex? Could it be endometrium? Could it be pituitary gland? So there we go. The answer would be corpus luteum. Now, first thing what you need to understand is the progesterone. Progesterone, the main function is to prepare the endometrium, which is the lining of the uterus, for a fertilized egg to implant and grow, right? That is the main function. So if a pregnancy doesn't occur, the endometrium sheds during your menstrual period. So if conception occurs, then progesterone increases to support the what? The pregnancy. Now, we have now known what basically forms this particular hormone called progesterone. It is formed by corpus luteum. This is the answer, corpus luteum. Now, what is corpus luteum? What does it do, corpus luteum? Now, your corpus luteum is a completely normal cyst that forms on the ovary every single month in the woman of childbearing age. Okay, so this cyst is actually a group of cells inside your ovaries that forms during each menstrual cycle. It appears right after an egg leaves your ovary, or rather called ovulation. Okay, now it is important to know the function, very important. So the function of corpus luteum, it produces the hormone called progesterone that your uterus needs to house a developing what? Fetus. So basically that is the answer. So progesterone is secreted in a relatively large quantities by which one of the following structures? The answer is corpus luteum. There. The next question says, in pregnancy, the muscle fibers increase is by a process called, right? In pregnancy, the muscle fibers increase is by a process called, so it is not these options given. The basic answer would be what is called hyperplasia. 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 Now, let's discuss what is this particular process, right? What is this particular process is. Now, we discover to say what basically caused this increase in the muscle fibers, right? So the endometrial hyperplasia most often is caused by, excess estrogen without progesterone. So if ovulation does not occur, then progesterone is not made and the lining is not shed. So the endometrium may actually continue to grow in response to what is called estrogen. So the cells that make up the lining may crowd together and may become abnormal. All right. So in simple terms then, what do we mean by aplasia or hyperplasia? What do we mean by this particular process in simple terms? So in simple terms, hyperplasia, okay, is just an increase in the number of cells in an organ or rather tissue, right? So in pregnancy, the mass of fibers increases is by a process called what? Hyperplasia. So basically that is what we mean by that. Now, what are the signs and symptoms for this? Okay, so when a woman who have endometrial hyperplasia may experience the following: there is bleeding between the menstrual period, heavier than normal menstrual period, and menstrual type bleeding after menopause, anemia, and in some cases due to heavy menstrual bleeding. That is actually what comes. Right, we go to the next one. Normally, the uterus is what? That is the other question. What is the uterus? Okay, what is the uterus? So, what do we mean by the word uterus? Is it an attached anteriorly to the bladder wall? Okay, then C, situated between the bladder and rectum, attached posteriorly to the anterior wall of the sacrum. Okay, so the answer would be situated and freely movable in the pelvic cavity. Situated and freely movable in the pelvic cavity. That is normally for the uterus. Now, the uterus is we can say, a pear-shaped organ in the reproductive system of people assigned female at birth. All right, and it is where a fertilized egg implants during pregnancy and where your baby develops until birth. So it is also responsible for menstrual cycle. All right, that is what the uterus do. Now, what could be then the function? So we discover now to say the ovaries produce the eggs that travel through the fallopian tube. Once the egg has left the ovary, it can be fertilized and implant itself in the lining of the uterus. So the main function of the uterus, it is to nourish the developing fetus prior to birth. That is basically the uterus. So normally the uterus is situated and freely movable in the pelvic cavity. That is the answer to that particular question. Okay, we carry on. The other question says the process by which the uterus decrease and the size to the pre-gravid state is okay. Now, looking at the question, there is the word pre-gravid, okay, or gravid. What do we mean by that? Before we answer, we need to know what this particular word mean. What is pre-gravid? So pre-gravid is actually prior to pregnancy, so before pregnancy. That is what we mean. So what is the pre-pregnancy weight? It is about, pre-pregnancy weight refers to woman's weight at conception. That is what we mean. Now, the word pre-gravid that basically means prior to pregnancy or before pregnancy. So the process by which the uterus decreases in size to the pre-gravid state is what? Could it be A, retraction, B, a contraction, C, autolysis? And then the basic answer, friends, it is gonna be involution. Involution, that is the answer. Involution. All right, involution. Now let's discuss what basically involution is, or rather an involuted uterus. Now, uterus involution is a natural process that involves your pregnancy uterus returning to its pre-pregnant state, okay, or pre-gravid, as if maybe you weren't pregnant, to say. So the process begins after you deliver your baby and the placenta, and it takes about 6 weeks to complete. So you may experience postpartum cramps called after pains during uterine involution. So what happens when the uterus involutes? What we actually discover is that the uterus shrinks back to its normal size and resumes its pre-birth position by the 6th week. So during this process called involution, the excess mass or mass of the pregnant, or rather pregnant, uterus is reduced, and the lining of the uterus called endometrium is reestablished or reinstated. Usually this is by the 3rd week. Okay, that is how we can actually explain this. Then now we go to question 6. It says the umbilical cord is also known as what? All right, the answer is actually there to say, okay, what is that name for the umbilical cord? What is the other name for the umbilical cord? So the umbilical cord is also called the theonis or funis. That is the other name. Okay, that is the other name. Now, what is this umbilical cord? What is this umbilical cord? The umbilical cord is actually the one that connects the baby to the mother's placenta. That is what you must know. So during fetal development in the womb, the umbilical cord is the lifeline to the baby, supplying nutrients. After birth, the cord is clamped and cut. Eventually, between 1 to 3 weeks, the cord will become dry and will naturally fall off. Right? The other thing that you need to understand is that the same umbilical cord in normal mammals, or rather human, also it is called the navel string, birth cord, and funiculus umbilicus. You can also call this, all right? You can also call it that way. So basically the answer could be C. Could be C. We go to 7 quickly. It says the following are the reflexes exhibited by newborn baby, except. So from that we discover now to say the basic answer could be A, gasping reflex. Now let's try to discuss what really this particular reflex is. Gasping reflex. Okay, what is it? What do we mean by it? Now, gasp reflex is actually stroking the palm, okay, of the baby's hand, cause the baby to close his or her fingers in a grasp. Okay, so the following are the reflexes exhibited by a new baby, except which one? Gasping reflex. What do we mean by this? So gasp reflex is actually the stroking palm, or rather stroking the palm of a baby's hand, like I said, causes the palm to close, his or her fingers in a grasp. So the grasp reflex lasts until the baby is about 5 to 6 months old. A similar reflex in the toes lasts until 9 to 12 months. Okay, and what does this basically indicate? So the palmar grasp reflex is a routine part of neurological examination done in the neonates. So even with just a psychogenetic role to play, it can provide clues to diagnose certain pathologies like cerebral palsy and also peripheral nerve injury. Okay, now what do we mean by walking reflex? Okay, walking reflex in babies. What do we mean by walking reflex? Walking reflex is also called the stepping reflex. Now, this reflex is also called the walking or dance reflex because a baby appears to take steps or dance when held upright with their feet touching a solid surface. That is what we mean by that. So, what stage or rather age does the stepping reflex disappear? It's about 2 months. 2 months. Okay, 2 months. Why do babies have the foot reflex rather? Okay, so it is important because that is the pathway of bundles of nerve fibers, okay, running from the brain down to the spinal cord are not fully myelinated or rather sheathed in newborns or rather infants. So it is important that they should have that. Then, what is moral reflex? Moral reflex in babies, okay, it is the normal reflex for an infant when he or she is startled or feels like they are falling, right? The infant will have a startled look and the arms will flinch out sideways with the palms up, the thumbs then reflexed or rather flexed. So absence of the moral reflex in newborn infants is abnormal and may indicate an injury or rather the disease. So what is the purpose of the moral reflex in babies? What we actually do is, or rather what is actually is that it causes an involuntary protective motor response. Okay, that is what we can actually explain. Then routine reflex in babies. Routine reflex in babies is just a basic survival instinct. So this reflex helps your baby find and latch onto a bottle or breast to begin feeding. When you gently stroke the corner of your baby's mouth with your nipple, they should instinctively, turn their head towards it to nurse. Okay, so that is how we can actually explain what these basically are. Okay, let's move on to question 8. Question 8 has this to say. It says the gravid uterus is lined by, is it endometrium, myometrium, perimetrium? So it is lined by what is called Decidua. Now, what is this Decidua? Let's try to explain. Now, Decidua is the specialized layer of endometrium that forms the base of the placenta bird. So the corpus luteum of the ovary, which is actually later the placenta itself, produces the progesterone that induces endometrial stromal cells to undergo cellular modifications and vesicular alterations, termed the Decidua reaction. So what is the Decidua lining of the uterus? So the Decidua cast is when your uterine lining sheds in one large piece as compared to drips and drops like your menstrual period. And this is taking place, remember, the gravid uterus. Okay, gravid uterus. Now, maybe we explain that. Gravid uterus, what do we mean by it? Gravid, in most cases, the gravid uterus transforms from a pelvic organ to an abdominal organ. All right, and in gravid uterus bad pregnancy, you discover to say it is, incarcerated gravid uterus is just a rare complication of pregnancy, to say. So, in summary, the gravid uterine insaculations is a rare but potentially fatal condition for the fetus that is in gravid uterus. So basically, the answer is B. We go to 9. The normal diameter of the placenta before delivery is what? What is the normal diameter of the placenta? So looking at what we are given, okay, normal diameter of the placenta. Looking at the options that are given, we discover to say we have 10 centimeter, 15 centimeter, 30 centimeters. So the answer would be 20 centimeters. 20 centimeters. Okay. Now, the maximum thickness of a normal placenta at any point during pregnancy is often considered to be 4 centimeter. Anterior placentas are about 0.7 centimeter thinner than posterior placentas, and maximum thickness for the anterior placenta is about 3.3 centimeter. And these they are very small size. Okay, what is normal placenta size at 20 weeks? 20 weeks, it reaches about that we can say and categorize this as anterior placenta is about 20.8 somewhere millimeter, sorry. Okay, so from this you are able to tell that the normal diameter of the placenta before delivery could be 20 centimeter. Okay, we carry on. Question 10 says, which of the following recordings on the partography will quickly alert the midwife of a difficult labor? Okay, what is the partography? First thing, okay, what is the partography and its parameters? Now, a partogram or partography is a composite graphical record of key data during labor, which is entered against time on a single sheet of paper. Relevant measurements might include statistics such as cervical dilation, fetal heart rate, duration of labor, and also vital signs. Right. So, what are the three components on the partography? The three components there, it is patient identification. Time, it is recorded at an interval of 1 hour. Then there is the fetal heart rate. It is also recorded at an interval of 30 minutes. Then state of membranes and color of liquor. Okay, these are actually intact membranes, which is C designated or designates clear and M designates meconium stained liquor. So basically, when you look at these options, the mid, mouthing, excessive fetal movement, cervical dilations on the left of the alert line. So which of the following recordings on the partography will quickly alert the midwife of a difficult labor? The answer is descending fetal head. So these are the questions, friends, that we prepared. May God bless you, and thank you so much for your attention. Support us as academia. God loves you, and God bless you abundantly and abundantly. Thank you so much. This was Malambo, the academia's admin. God bless.